I good? Okay,
Yeah.
so we did club drugs, which when we focused, there's a lot of different club drugs, but the ones we focused on were ecstasy and methamphetamine. And I did ecstasy, and one of the interesting things to know is that ecstasy was, I didn't actually do ecstasy. One of the interesting things is that it was made in 1912 to stop, it was experimentally made to try to stop abnormal bleeding. It didn't work, obviously. The Army used it in the 50s to try to interrogate people, and there's lots of different studies with it because it affects your brain chemistry. It's controlled throughout the world by the United Nations Convention on Psychotropic Substances, and it's actually classified the highest level of classification, Schedule 1 for the DEA, which means it's the most dangerous type of drug. Ecstasy you see a lot in obviously the club rave culture because it's a stimulant and it makes your heartbeat go faster, makes you sweat, which is you pop that Molly, make you sweat. That's because ecstasy gets you hyped up and gets the blood flowing. It gets that you get that euphoric feeling. You feel really confident and everything. There is some evidence that you have a hangover afterwards from it. And it also causes dehydration because you sweat, you grind your teeth, and you have nausea. But in large amounts, it actually can be very dangerous and harmful. We have this hole up here. It can cause hyperthermia, which is your body overheats because your heart rate's so fast and it can't control the heat well enough. Messes up your heart rate because of what it does to your heart rate, and also renal failure and damages your liver. And it's also addictive, so long term. There's a lot of different effects, such as sleep problems, feeling depressed. Basically, it's a bad drug. Don't use it. You're gonna see it in lots of raves, kids, and it looks harmless because it's in little tablets generally, and it's just you just pop a pill. It looks like a candy almost. But in reality, it's gonna affect your body, your brain chemistry, and your entire body and how you function. That's the ecstasy.
And now, I'm going to talk on meth, which is a very destructive drug. Once again, it's a stimulant, so people take it to get work done, and they can sit for 24 hours at a time. But usually afterwards, they have a crash where sometimes they'll sleep for days and not really remember what happens. So it's a stimulant as well as a mind-altering drug. It can cause psychosis, aggression, disordered thinking, extreme mood swings, and sometimes hallucinations. So a person on meth kind of seen as a dangerous person because they're really not in control. It's kind of like ecstasy on steroids because it's not like a euphoric feeling. It can be aggressive. And then the components of meth are actually really kind of gross and harmful for you. They have hydrochloric and uric acid in it, which are both extremely corrosive, and oftentimes meth houses have to be condemned because people can't live in the conditions after those compounds have been used. So that people ingesting that shows that that's clearly a very detrimental drug. Over time, it changes the dopamine factors in your brain. So people who become addicted to meth actually have a physical dependence on meth because their brain has a restructured dopamine system so that your body craves and needs meth. Some of the side effects of meth are meth mouth, which is while you're on meth, you drink a lot of sugary drinks, your body craves sugary drinks, and you tend to have bad oral hygiene. So your teeth and gums begin to rot, and over time, you basically have you have to get either dentures or replacement teeth because you have no organic material left in your mouth. And then finally, probably the thing I find most disgusting about people who are on meth is they have feelings like bugs are crawling through their skin. So all these pick marks on people's faces and stuff are from them trying to pick out the bugs or that feeling in their skin. So they often don't realize they're doing it. They're trying to pick stuff out of their body. So meth can be taken in pretty much any form. It can be inhaled, ingested, or injected. So it comes in many forms. It's very dangerous. It was used back in the 1970s as a stimulant and a weight loss solution, but it's rarely on the market now because it's seen as very dangerous and it's only prescribed to cure severe obesity. So,
is it really?
Yes, but only in very rare occasions. It's very.
I haven't been those prescribed to cure obesity. Also, shout out to Gene over here for doing the poster.